Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host of the Dean's Chat podcast. My guest today is Dr. Tracey Vlahovic. She's a longtime leader in our profession. We're going to have a long discussion today about all of her activities in the profession, but I just wanted to give a few tidbits of her background. She did her undergraduate work at Yale in molecular biophysics and biochemistry. She's a 2000 graduate of the Temple University School of Podiatric Medicine. She did a 2-year residency at St. Luke's Hospital in Allentown, Pennsylvania. She followed that up with a 1-year fellowship in podiatric dermatology. She is board certified by both the American Board of Podiatric Medicine and the American Board of Foot and Ankle Surgery. She's also a fellow of the Royal College of Physicians and Surgeons in Glasgow. Currently, Dr. Vlahovic is a clinical professor in the Department of Podiatric Medicine at Temple University School of Podiatric Medicine. She's held that position since 2018. Welcome to Dean's Chat, Dr. Vlahovic.
Thank you so much for having me. I really appreciate it.
Oh, it's a pleasure. Thanks for carving out time to be with us today. You know, Tracey, on Dean's Chat, we go with kind of a fireside chat vibe. So I was hoping we'd go with Tracey and Jeff for the rest of the discussion today.
Perfect.
You know, I wanted to get started by asking you about your podiatric journey. You know, how did you go from being at Yale, and as I said, it was a molecular biophysics and biochemistry undergrad. How did you go from doing that to Temple University School of Podiatric Medicine?
Well, when I was at Yale, I was torn. I knew that I wanted to do something afterwards, and I wasn't sure if I wanted to go to graduate school or to medical school. And there were just a lot of choices and wasn't really sure what to do. So I was nosing around in the Sterling Memorial Library on Yale's campus, hidden away in the stacks, which no one could find me there. And I was doing some light reading, some fun reading on dancer biographies and autobiographies just to get away from studying biochemistry and calculus and all of the things that I was studying every day. And it was my pleasure reading. And one day I found a book called Medical Problems of Performing Artists. And I started flipping through it and thinking, wait a minute. I went to more than one podiatrist when I was a young dancer. And why didn't I think about this before? It just made so much sense with my background in dance and my want to go into medicine that I would pursue podiatry. And that was the beginning of it. And then after that, started the whole process of going to the career office and saying, hey, what do you know about podiatric medicine? And they didn't know a lot, unfortunately. And I just started researching as much as I could on my own. It just felt like everything clicked in, like it was a good fit for me.
So once you thought podiatry might be the ticket, did you end up shadowing some doctors and reaching out and or did you feel that your experience being treated by podiatrists was enough?
Well, I had to shadow a podiatrist as part of the application process. So I did shadow some doctors in New Haven, Connecticut, where Yale was or is. And I also had that experience. So that was enough. But when I arrived at Temple, I also spent some time with some podiatrists here and in New York City who work with dancers. And so I knew that I could work with dancers, that I could understand the psychology of what they were doing, but also my, love of understanding why we move and how we move would just, again, make so much sense.
That makes a lot of sense. So you went to Temple, you were there for 4 years, and then you went to do a residency program, and you did 2 years of residency, and then you followed that up with a fellowship, and you found your niche, if you will, in dermatology. How did that play out, Tracey?
Completely surprising. So when I was in podiatric medical school, like most students, I was indoctrinated into the cult of trauma rear foot surgeon. And so that's really what the path I thought I would go down. And there were certain classes that I had at Temple that weren't my favorite, and dermatology was one of them. Sadly enough, the professor who was a very well-known, well-respected dermatologist, had an interesting way of teaching. So he would ramble on about topics. He would show, slide carousels and then have these exams with, slide identification. And it was virtually seemed impossible. And I have a photographic memory. So there were certain things I could remember, but certain things just blurred all together. And, everything looks like a red rash. So when I started my residency at St. Luke's in Allentown, Pennsylvania, I dreaded my dermatology rotation and started that rotation. And the attending was fantastic. And he would every day ask me, "What is this?" And I was like, "I don't know." "Well, go look it up." "Okay." Next day, see the same thing. "What is this?" I'm like, "That's blank." It's like, "That's correct." And so every day, this was what was happening. And I eventually built up my confidence, but also just my clinical diagnosis with the visual, diagnosis of everything. And at the end of my rotation, I said, I really want to keep in touch with you. This was such a great experience. I had no idea that I enjoyed this that much. And he said, "Of course." So when the time came that I was trying to decide what I was going to do in my residency program beyond that, I spoke with my residency director and said, "Hey, I had a really great experience in my dermatology rotation, and I'm looking to do a fellowship. Do you know of a dermatology fellowship for a podiatrist?" He said, "No, but we'll create one for you."
Well,
So it was actually created for me, and I took the chance that it may not have been approved officially. So that was a risk I was willing to take.
So were you part of the development of the curriculum for the fellowship, obviously?
Yes. I was able to choose my non-dermatology rotations. And of course, I had to do some podiatry rotations so I wouldn't lose my surgical skills and all of that. So, I chose endocrinology and plastic surgery. I'd already done a plastic surgery rotation, but I wanted to do another one. So I was able to be involved with all of that and the goals and objectives of it.
That's great. So throughout this entire process, Tracey, one of the things I've found in interviewing leaders in our profession is they all seem to have mentors that have helped guided them along their way. Did you have mentors that helped you?
Well, definitely my dermatology attending, Dr. Steven Schleicher. He was instrumental. During my original rotation, he would take family medicine residents once they graduated and would train them as fellows to do dermatology in rural parts of Pennsylvania. So the amount of patients that were seen in the office, the experience, and then he's just absolutely brilliant. I always call him, he's the mad genius. He would walk into a room and within 30 seconds would tell you the diagnosis.
Wow.
I mean, he's just incredible. So he was an inspiration, but also he was willing to take that risk teaching me, doing something that had never been done before. So I'm eternally grateful that he, first of all, had that visionary, that visionary experience of saying, let me train people so that they can help people around areas of Pennsylvania where there's just a lack of dermatologists, but also here's this podiatrist out of the blue who wants to learn all of this too. So, he would see over 200 patients a day. And I would run from room to room to room along with the other fellows, seeing everything from acne to alopecia to, anything else lower extremity that would come in. So I was able to experience it all. And so when I teach my dermatology course at Temple, I'm able to teach from head to toe. So it was a life-changing, phenomenal experience. And interestingly enough, many people in my residency program said to me that I was making the biggest mistake of my life.
Wow.
So many people just did not understand what I was doing, why I was doing it. Why aren't you just going to work in private practice? And I just felt such a pull, such a desire to do this. And it manifested.
Just goes to show you got to follow your passions. It's very similar to Dr. Joseph. When he did his infectious disease fellowship, he had a lot of people poo-pooing that idea too.
Yeah, and he definitely was an inspiration as well because I knew he had done that fellowship. So I knew that the possibility of doing something unique was there.
Absolutely.
And I'm grateful again that I had not only the dermatology attending, but my residency director at the time who saw this opportunity as a way of giving something back to the podiatric profession.
Oh, that's fabulous. Tracey, as I was reading your CV and I was looking at all of the things you've done, you are the quintessential triple threat, as we call it in academics. You're a clinician, you're a researcher, and you're a teacher. Can you share with us how you got involved in teaching? And you've been at Temple now, you said, since 2003?
Correct.
Wow.
Yeah. So it's the last day of my fellowship. The next day I started at Temple.
Oh, really?
So, June 30th, July 1st, I started here.
Wow.
So there was no rest for the weary.
I guess.
I knew probably about halfway into my fellowship that I needed to do something with this material, that I couldn't keep it to myself. And so I realized that one of my goals was to give back to my profession. So I looked for opportunities to do so. And it just so happened that at where I graduated from, they were looking for a dermatology teacher. So the original professor I had as a student unfortunately retired, but they had somebody teaching in the interim and it was not going well. So it was actually a university group of residents that they just didn't understand podiatric medicine. So I was in the right place at the right time, so to speak, to get this position and then create this course with what I had learned, not only with my fellowship, but also what I felt was needed to be taught in our profession. Because I just feel that dermatology is something that so many people feel weak. When it's one of the things that more than 50% of what we see in the office is dermatology based. So it's my goal to really just educate the generations of students that I have, but also to the folks who are practicing already.
It's fabulous. So as you've worked your way up the ranks at Temple, how have your responsibilities changed? Have you been, aside from teaching and seeing patients, what else do you do at the university then?
So, when I first started teaching here, I thought about all of the teachers I'd had from kindergarten to, podiatric medical school, and thought about what I really liked about teaching and their teaching, what I got from it, how I reacted, and what I had retained because of how they taught. And so that's how I approached teaching at first. Unfortunately, that sage on the stage, but yet in a way that I was hoping would be practical and sometimes humorous. And I'm not afraid to make a fool of myself sometimes when I lecture. I've done crazy things in the classroom, including, flash mobs, you name it. I've done it. Anything to keep their attention. But also, after a while, I realized that we're not trained teachers. Those of us at the graduate level, most of us are just not trained teachers. So the opportunity came for me to go to the Provost Teaching Academy many years ago and learned more about active teaching. And it was a revelation. There were certain things that I had first thought, how am I going to do this in a classroom of 100 people? It seems impossible. It seems more suited for a liberal arts class, like a philosophy class or an English class or a language class. But there were certain things that I could take from that and apply it to my lecture class. And that's been fun over the years, just sort of playing with the techniques that I learned there. But it also made me realize that beyond just being a classroom learner, I had already done these active sort of techniques as a dancer. When you take a dance class, your dance teacher doesn't give you a lecture. When you start class, they show you and you actively do it. And that's how you learn, is that by that repetition, by experiencing it in your own body and getting pointers on what you're doing incorrectly. So becoming a better teacher has definitely been a passion of mine, because not only does it affect what I do here with my students, but when I lecture outside at conferences, I hope that it makes me a more engaging speaker. But also beyond teaching and seeing patients, and I truly enjoy seeing patients. I love challenging cases. I love cases that really make me dig deep into my dermatology training, and that's fun to me. That, the more challenging, more puzzling it is, that's fun. But also I do research. So I did, bench research as an undergraduate at Yale. I did it all 4 years, and I loved being in the lab. I still do, but now it just looks different. Now it's spitting blood down and playing with cultures and urinalysis and all these things that are involved with the clinical trials that I do. So I've been heavily involved in doing clinical trials for many, many years here at Temple, and certainly in continuing. I just started a new clinical trial recently and have more coming up. So it's a passion of mine to be able to do all the things that I do in a day, because I never get bored. And that to me is so important, that I'm always using my mind, always experiencing something new and learning myself, and learning new things, whether it's about a new drug or with these clinical trials, they're all done a little bit differently, and there's just sort of quirks to them. So that to me is just fun.
So let me ask you about those clinical trials. I've done a lot of clinical trials in the chronic wound care space, but I haven't done any in the dermatological space. What kind of trials are you doing? What are you studying? And what's coming up? What's coming down the path?
So most of what I do is with nails. So I've done a lot of athlete's foot or pedis trials, but nails are a big one. And nail trials are a year long. They are incredibly long experiences. There's a lot to them. The patients really have to sacrifice that year with coming in for frequent visits, having their blood work done periodically that we're doing here, using the medication every day, oftentimes for 48 weeks. So, and also because there is either a placebo or a vehicle arm, that they may not be getting any treatment at all.
Right.
So that's a risk that I'm grateful that some of them take. And that process is just fascinating to watch, because as an investigator, I'm hoping that whatever we're doing ends up getting approved or ends up having good data to get FDA approved. And I've been in more trials that never made it to the light of day. The data was awful and just failed miserably. That's as fascinating as the drugs that come to market and seeing what happens with those medications over time. So nails has definitely been a focus. I've done wound care ones, of course, and with athlete's foot. So currently I'm doing an onychomycosis trial, and I have a couple more coming up. And I also have one involving IPKs. So that's exciting to see what will happen with that.
Very good. Are you involved in designing the trials and inclusion-exclusion criteria? Are you helping the companies with that too?
Certain ones. So there's a difference between, something, a new drug that is to get FDA approved. I'm usually not involved with that protocol. I'm more involved with the investigator-initiated trials. So I've done my share of investigator-initiated trials where I'm creating the protocol and the budget and everything else, and going from there and hoping that we get the funding to do it and then, proceed from there.
Very good. Yeah, I've done a bunch of those investigator-initiated ones. That's a lot of fun, actually. Get to put your own team together and your own ideas. Congratulations.
Exactly. And I have a plethora of eager students who always want to do something.
Oh, I'll bet.
They're the ones who keep me active.
So you've got the teaching thing going, you've got the research. Now I'm going to ask you a question about this incredible number of publications you have. You have 72 peer-reviewed publications, and that doesn't even count all the non-peer-reviewed publications. And on top of that, you've got 7 book chapters and 3 books, and recently the Atlas of Lower Extremity Dermatology. Congratulations.
Thank you.
So I ask a lot of my guests this: when do you sleep, Tracey? All this work you've got going on, how do you do it?
I don't sleep much.
Mhm. And then
Once I was in residency and had at one point 4 pagers, I had 4 pagers. I stopped sleeping. So I haven't had a good night's sleep in a really long time.
that's funny. And I think a lot of people can relate to that. So talk to me about putting a book together. You've written 3 books. It's a monumental task, and you've got, how do you outline that? How do you get it going? How do you find a publisher? I mean, what's your playbook for that?
So interestingly enough, my 2 goals when I started work at Temple was very simply, I wanted to become a professor. So I knew I had to work up the ranks from instructor to professor. I wanted that. And I wanted to write a book. So I was like, anything beyond that, icing on the cake. So I was at one of the APMA national meetings, and I was speaking with one of the publishers and just having a chat, just a friendly chat. And I said, my goal was to write a book. He said, great, we'll publish it. What? And that's what happened. And then it was this very fast cycle of writing as quickly and as much as I could, along with my dermatology attending, because I was like, who else am I going to write a book with but him? Because again, he's my mentor, but also he knows he's a genius. So it made sense to work together. And that's how my first book happened. And years later, my most recent book, they actually emailed me and said, hey, do you have any ideas? And actually, I do. So I always feel like with these books, I hear like a little whisper in my ear, like, write me.
Sure.
And it is a monumental task. But again, I know that whatever I put out there, I'm hoping is going to be relevant and useful and practical to people. And that's what keeps me going, is knowing that I hope that I'm going to be helping other patients that I've never met.
Oh, that makes sense. And congratulations to you. I thought it was ironic that we're doing this interview today. And just earlier in the week, I saw that you were on the cover of Podiatry Today talking about dermatology. But that was your second cover, right?
Third
cover.
Yeah, third cover.
Wow, very good. It's like the cover of the Rolling Stone 3 times.
I know. Now I just have to get myself on Saturday Night Live.
Okay, there you go. All right. So, there's no such thing as all work and no play. And I've seen a lot of your Facebook posts of you've got a dancing career to this date. Can you comment on your dancing? Because I know that was a very big part of your life when you were younger, and it carries through to today.
Yeah. So my parents put me in dance class when I was 3 years old. And as typical me, I hated it. They tell me the story of me sitting in the first few classes, sitting and watching the teacher and saying, I'm not dancing. And suddenly I just got up and danced, and it has been the love of my life ever since then. Like, it is so much a part of me. It's a part of who I am. It's one of the reasons I chose podiatric medicine, because innately being a dancer, understanding the physicalness of movement. And, I would be sitting in lower extremity anatomy class and thinking, all right, this is what I would use to plie. This is what I would use to pirouette. This is what I would use to point my foot. And just, it was just an amazing thing to have what you love, more so than my hobby, my passion, intersect with what I do every day. So, growing up dancing and then pursuing as much as I could with that, being a theater kid and going to New York and auditioning and doing all the things that one does when you're in that world, has also just shaped me as a person. I mean, I love art, but if I wouldn't have had the experience of being on stage and taking acting and singing and dancing classes and all of those different things, I don't know if I could be in front of an audience the way that I am at conferences. Like, I gave at one conference recently, there were 750 people there. So I don't get nervous because I'm just used to being in front of people. And so that experience of dancing has and performing has certainly, come through in everything else. But for me as a dancer, almost every week, I take class with these amazing coaches who really run me through the paces in what's called Latin ballroom dancing. So if you've seen Dancing with the Stars, you've seen people do waltz and foxtrot and tango. I know how to do those, and I competed in those in college. So I joined the Yale ballroom dancing team when I was in college, and I danced everything. And then when I went to podiatry school, I would take the train all the time to New York City and train with one of the coaches that I met at Yale. I would train in what's called Latin dancing. So Latin ballroom dancing, or the international style, I should say, is rumba, cha-cha, paso doble, jive, and samba. And those 5 dances are basically what I absolutely love to do, and have competed in those since I was in college, and still do compete. I competed a year ago. I have to compete again sometime this year. Timing is always challenging, which my coaches love. But I did quite well a year ago. So that was definitely a feel good moment that I still had it, still could dance, and still could do well at it.
That's really neat. When you're talking about this, I am envisioning like an Olympic gymnast has a routine. Is that what you do in these competitions? Do you have routines?
We do practice routines. There's so much about technique that's important. The technique is your baseline. It's like spelling and grammar in dance. So you have to work on the technique, and then we do have these routines. And the routines, you never know what music they're going to play in a competition. So you don't know how fast it's going to be. You don't know what song it's going to be. So, but you do have an idea what the beat should be, what the rhythm should be. And you take your chance. And the whole thing is that even though I'm the one who's being judged, so I dance in what's called pro-am, which is professional amateur. I'm the amateur. So my coach isn't being judged, but I have to follow his lead. And so it's a partnership. And that partnership is created in the dance studio where there's trust, where there is communication that's nonverbal, because I have to feel where he's leading me. And if there's another couple that I'm going to collide with, because I'm dancing backwards, right? And I was ballroom dancing with women. Women are always going backwards in heels, and that is the truth. So I can't see behind me. So I'm depending upon my dance partner, my coach, to not have me fall over someone else or collide with someone else. So I have to follow that lead. So there's a routine, but it's dynamic because I really have to make sure that I am following his cues.
Wow.
So you can't talk on the dance floor.
Oh, I did not know that.
Yeah.
So when you go to a competition, how many couples are competing against each other?
Oh gosh, it depends on the competition. It depends on the age group. I remember in college, the dance floor just filled with 50 couples. And what happens is when you have that many dance couples on the floor, you have to go through heats. And so ultimately you start out with that many, and then many get eliminated. You go, from to semifinals, to finals, to, whatever. So you can be dancing quite a lot in these competitions. So my endurance has to be up there in order to do this. So I have to be able to, dance in heels, wear a lot of sparkly things, and have that endurance to dance. So that's all part of training. It's not just the artistry of it, and again, the technique and the routine. It's all the things that go around it. So it's like anything that you love doing, you just do it. Absolutely. Like it's not a chore. It's like, all right, well, I got to work on this today because I want to get better. I will make such silly mistakes sometimes during my dance class because sometimes my brain is still in my practice, right? So my brain is still at work, and my teachers will say, "Get out of your head." I'm like, "Okay, we'll do that." And then they'll say, "What was that?" And I was like, I've become a T-Rex, like my arms are just doing this and not being graceful. So, I appreciate that they always want me to be better, that they're always calling me out. But it's also good practice for me to get out of my head and get out of that space that I'm in every day. So it really kind of puts me in my body, but also allows me to just have this joy that I have when I'm dancing.
I just love stories like this because when I do these interviews, our profession is incredible, right? And there's a lot of commonalities, and some of us find different niches in different areas, but everybody seems to have an outlet, and outlets are just so vast and variable. It really gives credence to the need for the work-life balance also.
Absolutely. No, ballroom dancing is my saving grace. There was a time during residency I was on call 7 days a week, every other week for my first year, and had 3 vacation days. I couldn't dance.
Okay.
And I remember one day thinking to myself, why am I so depressed? I mean, I'm exhausted, but I'm missing something. And I was like, wait a minute, I can't dance. I come home, I am exhausted and I can't dance. So when I could start dancing again, I was so much happier.
That's great. Hey, Tracey, if you weren't a podiatrist, what would you be?
Oh, I threatened my parents with this many times. I would be a dancer.
Oh, that's what I was going to say. I said, that makes sense. I could see that, a professional dancer.
Yeah. So when I was in college, I would call home and I would say, I'm going to go to grad school and get my master's in dance. And my parents would say, okay, you do that, but you're still going to be a doctor, right? It's like, yeah, maybe.
Oh my gosh. Oh, those are just great stories. Oh, then it's so great to see people weave fun and passion into their professional life. So congratulations on just a tremendous career. Tracey, if you were talking and you talk to prospective students all the time, what would you tell them about podiatric medicine?
Well, podiatric medicine is what you make of it. And there is, for me, a lot of fun in speaking with patients. I've gotten to know so many interesting personalities and people over the years, and they make me laugh. They make me have a lot of thought, because they'll come in with an interesting book. You say, what are you reading? And they'll tell me all about it. I'm like, oh, I should read that. Or just, different ideas. But also there's something about being able to often give a treatment to a patient and see them from the time that they come to you to the time that you discharge them, because you've managed what their initial problem was, right? So for me, maybe it's a skin rash, a wart, nail issue, and to see them happy and feel satisfied and not as focused on what's wrong with what's going on is a joy. And that is something that I can't imagine. I don't know what, except for dermatology, like what other professions are doing. Because in dermatology too, you see patients with acne and they go through the whole process and they're depressed and they're sad. And then, you manage the acne and their skin is clear and there's just such a light and more self-confidence. So it's the same thing here, when I can offer a patient something that's different or unusual to treat their nail issue or what have you, and they just jump out of the chair and they bear hug me, that is, I can't ask for more than that. So there's a joy in bringing people something that you can palpably see and feel.
And that's an inherent need. I mean, people that are going into medicine, that's why they're going into it. They want to help people and experience those relationships and helping others. So no, I agree with you. It's just a phenomenal profession. I think one of the reasons podiatrists are so happy is they tailor their practice to what they like to do. And I think that's really a great opportunity.
Absolutely. Those who are runners or that they've done something in sports and then they find that niche with their own patients. I always say, they always say, if you build it, they will come. It's the same thing with us. If you put yourself out there as someone who wants to work with high school sports teams, or that you want to do those amazing surgeries, like one of my classmates does all of that amazing stuff at the Paley Institute in Florida. It's when you put it out there, those patients will find you.
Absolutely. Well said. So, Tracey, we're kind of running out of time here. I do want to thank you for carving out time during the day, and I want to thank you for all you've done for our profession. Carving out this niche, if you will, in dermatology seems to have really agreed with you. But the world may have lost a phenomenal professional dancer.
No, really not.
Oh, well.
I'm still an amateur. It's all good.
All right. Sounds good. Well, again, I want to thank you. And one of the things we do, Tracey, on Dean's Chat is I'm going to send you one of these Dean's Chat cups. And when you get it, send me a picture with you holding it, and we'll put it on the YouTube video.
Sounds good.
So thank you again. And to all of our listeners out there, whether you're on Apple or Spotify or Google Podcasts, please give us a 5-star rating. And if you're watching on YouTube, please become a subscriber. And until next week, cheers, everybody.
Thanks again for having me, and thank you for all that you're doing for our profession.
Oh, likewise, Tracey. Thank you again. Okay, bye-bye now.